Hello, and in this video we will be talking about the placebo effect. We'll be talking about topics such as what it is, how it works, what influences the placebo effect. Is it possible that CBD is a placebo effect? As well as talk about what the literature shows or studies, and wrap it all up by talking about what all this means, what my opinion of it is. So join me as we unwrap the details of the placebo effect. So welcome. I'm Dr. Jack, and thanks for joining me on this video. This is a very important topic and really fascinating too, so I hope you'll stick with me and watch it through to the very end. This research that I've been doing on placebo effect mainly started because various people have been coming up to me and talking and asking, is CBD a placebo effect? And so I started researching it, as I always do with all these things. And I just want to share with you guys what I've discovered about the placebo effect. So for beginners, let's jump into what exactly the placebo effect is defined as. So it is defined as a beneficial effect produced by a placebo drug or treatment which cannot be attributed to the properties of the placebo itself and must therefore be due to the patient's belief in that treatment. So put another way, it's basically your brain convincing your body that a fake treatment actually is the real deal. Scientists used to look at this within various studies, and basically they would compare it to, okay, you have drug A and then you have placebo. If drug A was more effective than placebo, then drug A must obviously work. However, now after more research has been conducted, we've realized that there's actually more to the placebo effect than we first realized. Now we kind of look at it as when drug A is compared to placebo and placebo actually becomes more effective or just as effective, the thinking now is that there might be a different pathway that is contributing to whatever disease or ailment that drug A is actually trying to treat, and that's not being realized as being affected by the placebo effect. And as we get into this talk a little bit more, that will hopefully make a little bit more sense to you. What scientists now realize is that it is a lot more than just positive thinking, if you will. It is a demonstration of just how powerful the mind is in regards to your overall health and wellness. And this is sort of echoed by a previous video that I did about meditation, and please feel free to check that out. I'll link it above as well as below in the description. The placebo effect has not been shown to help things like lower your cholesterol or lower your blood sugar or help reduce a tumor size or cancer or things like that. But in regards to symptoms or complaints that are controlled or modulated by the brain, such as stress-induced insomnia, variations in heart rate or blood pressure, IBS symptoms, pain, fatigue, or nausea related to cancer, all these factors through various studies, which we'll get into here in a little bit and touch on some of it, has been shown to be influenced. And another term to become familiar with when talking about placebo is the nocebo. And what nocebo is basically a placebo that causes side effects. So various studies have shown that patients have taken a placebo and complained of side effects such as, the more common ones such as headache, nausea, fatigue. And there was actually one opiate study that the placebo basically ended up causing respiratory depression because the patients believed that they were taking an opiate. Nocebo has been shown to reduce opioid and dopamine receptor activity. Dopamine is a neurotransmitter in your body that essentially is tied to the experience of pleasure. And the placebo effect actually has been shown to have all the opposite effect as at the opioid and dopamine receptor activity as well. So the short answer to how the placebo effect works is that we don't know. And, scientists are trying to piece all this together, and they have all these working theories. And one of them is that it is possibly a hormone response. And the placebo effect, it has been shown to have a sort of a complicated neurobiological process. When we see it, it increases brain activity in areas that experience like pleasure and mood and all these sorts of things, as well as it being tied to your body's own endorphins, so it's your body's own painkiller, and also again related to dopamine. And scientists have also determined that, again, as mentioned before, with the opiate receptor activity, that there is something going on at that level as well, because there was a study also conducted where they gave the patients naloxone, which is what you give to patients that's overdosed on opiates because it reverses the effects of the respiratory depression. When they gave naloxone to patients, they also reversed the effects of the placebo effect in patients as well. And the other working theory, or something else that may play a role, is expectation as well as conditioning. It plays a part as well from what we see. So if someone expects a treatment to work or goes into it with very sort of a positive mindset and really wants to get better, it has been shown that the placebo effect has a higher chance of working as well as an amplified effect. Environment as well as the process matters when looking at the placebo effect. So when someone goes to see someone in a white coat, tends to create sort of a positive healing mentality, that they're going to someone who is there for them to help them get through a difficult time or some ailment or something like that. And basically it just boils down to, if you feel like you're being cared for, it really does matter. And they found that various cues also matter, cues such as verbal. So if you go see a doctor and the doctor is really positive about it and tells you that, hey, I really expect this to work and help you, I think, there's a really high chance that you're going to do well with this. That matters, as well as the action. So are they getting an injection or taking a pill? They found that people that take, pills or do something to them, or if they take some type of action, what ends up happening is that the more frequent they do the action, the higher chance that the placebo effect may work for them. And then finally, social cues matter as well. So the doctor or clinician's body language, as well as their tone of voice and how they make eye contact with the patient, all of that also instills this sort of confidence that the patient starts getting, feeling that they are being well cared for and that whatever they are suffering from will get better under this particular treatment plan. So now let's dive into some of the really interesting studies that I thought was worth mentioning and presenting to you guys. And we'll start with the 2014 study looking at headache medication, specifically Maxalt. And it was basically looking to compare Maxalt to placebo. And the placebo was found to be 50% as effective as the real drug during a headache attack. This was regardless of whether or not they knew it was a placebo or not, they being the actual patient. And they found that even if a placebo was labeled as Maxalt and the patient taking it knew it, it was just as effective. And so they theorized that the act of taking a pill has positive effects, and it is enough to stimulate the brain to think that the body is healing due to conditioning. There was also a 2018 study looking at fatigue, where they took cancer survivors and looked at placebo treatment for the cancer-related fatigue, and they did a 21-day treatment with a placebo and found significant effects where the placebo helped with their fatigue. And there was a 2015 depression study. The participants knew that they were taking a placebo, and what they did was they did a PET scan on the patients, and what they found was that after giving them a pill or an injection, that it showed increased brain activities in areas associated with emotion as well as stress regulation. So in one study, the endocannabinoid system, which if you watch my other videos, you know that it is the cannabis system within our own body that helps to regulate and modulate homeostasis within our body, had a pivotal role in placebo analgesia, or pain relief, whenever the opioid system is not involved. So whenever people get pain relief, essentially they have a opiate route, which narcotics or opiates are known for basically binding to those receptors, and then there's a non-opiate route. But what we know in regards to the endocannabinoid system is basically that if you take a pill or any substance that causes some type of positive outcome, that what we see is an increase in anandamide, and it is instrumental in how the endocannabinoid system works within your body. There was another study that looked at MS patients, and CBD showed relief more than the actual placebo. This one particular study showed that when they were using CBD to treat seizures, specifically a disease called Lennox Gestalt syndrome, they found one person actually ended up withdrawing from the study due to severe adverse effects. And so again, that's the nocebo effect that we talked about before, and it just kind of goes to show how strong that effect actually can be. There was actually a Danish study where in 2008, they found that 48% of doctors there actually prescribed placebo, that they have done this in the past year. And most often it was things like giving a sugar pill or a placebo pill to patients who they felt very strongly had a viral illness and really did not require antibiotics, but the patients were just very, very adamant that they get it, even though it's not going to help, and just kind of breed drug resistance. And also they gave it to them for fatigue. And what they did was basically prescribe them some type of vitamin or something like that to help with fatigue, or again, a different placebo pill. I can tell you that my mom takes CBD, and it took her, after about 4 to 6 weeks of taking it consistently for rheumatoid arthritis, I have physically watched the actual swelling in her joints decrease from the inflammation. And my clinical experience in regards to how I've seen it help so many patients, again, if you know how to kind of walk a patient through the entire treatment process, make sure that you increase their dosage, get them to a decent dosage for whatever ailment they have. And it's all very complicated. I'm not going to rehash all the other 10 videos or whatever I've done on CBD. Just feel free to check those out if you want. You know, a lot of doctors, clinicians, scientists out there who feel that there just isn't enough evidence to support whether it helps in various things. But there's also a growing body of clinicians like myself, as well as scientists, that are seeing the growing body of evidence showing that CBD has been shown to be beneficial for all types of various ailments. Again, if you're buying a safe and high quality product and going through and educating the patient on how to take it and use it. What we do know, and these are absolute facts, is that the endocannabinoid system modulates every major system inside your body and plays a major role. And what we also know is that patients that have various ailments, such as fibromyalgia or some patients with chronic migraines and things like that, that they have deficiencies within their own body's endocannabinoid system when you look at their body's own endocannabinoids, such as anandamide. And to be honest, I could see why people may think that CBD is possibly more placebo effect related, but even on drugs that are FDA approved in various studies, the placebo effect has been shown to be as powerful as 75%. In regards to CBD, various people have been reporting that it seems to help them with all sorts of ailments. It seems almost too good to be true. And so a lot of people sort of approach this with a skeptical eye, again, not really understanding how it works and why it works, nor taking the time to actually educate themselves about all of this. And people also do not understand that cannabinoids do not affect everyone the same way. So we're getting sort of into the dosing video that I did. The amount that you need for whatever you're taking it for, it might be very, very different for the amount that I need and how quickly it works for me, just based on so many different factors like our height, age, weight, genetic makeup, and how bad the ailment is, or what we're even treating it with. And a lot of people also do not realize that it takes time. It can take anywhere from 1 to 3 months for it to work. They associate cannabinoids as all kind of tying into THC, and THC having a very fast onset of time to effect. And if you're looking at the other cannabinoids like CBD, CBN, CBG, all these other things, they take some time to sort of work for you, and that is only after you've gotten to the right dosage or a respectable dosage for your given situation. So what are my thoughts about the placebo effect? And reading about studies like the Danish study where doctors are prescribing patients placebo effect there, or placebo pills. And I don't know about the ethics surrounding this. I could see it kind of both camps of argument here. On the one side, if you are prescribing just a sugar pill or a placebo pill and with really no dangerous side effects, take the situation where a doctor is prescribing a sugar pill to someone for a viral illness, and because they feel very strongly that it's not bacterial and that they would just breed disease resistance out in the community by not prescribing the appropriate treatment, even though various patients are very, very adamant that they get that treatment. You know, in that scenario, I could see the good that's coming out of that, right? By decreasing drug resistance and essentially doing what a doctor feels right by using their diagnostic tools and their experience and prescribing the appropriate treatment, which in a viral illness, there really isn't any treatment other than, you know, more supportive measures. And, you know, I talk about viral illnesses, I'm talking about like, you know, the average cold or something. I'm not talking about like coronavirus or something like a novel coronavirus. And also take this circumstance where in that same scenario, you could have a situation where maybe the patient was misdiagnosed and maybe it was something a bit more serious and they actually did require antibiotics. You know, I could also see the advantage of, say, a situation where someone was in a very traumatic car accident or something and they suffered massive lung injuries and they're laid up in a situation where they're in a lot of pain, but they have breathing problems as well. And so in that situation, obviously you're limited by giving a patient opiates to help them with pain because it will suppress their breathing even further, possibly to, you know, setting them up for a situation that's dangerous for them. You know, in that scenario, say if someone were to tell a patient that, hey, this is a very powerful pain medication I'm going to give you, and they give them an injection through the IV while they're in the hospital and it alleviates their pain and there's no respiratory depression, you know, in that scenario, is something really bad being done there if we're seeing the same type of effect? So I think it's an interesting question to kind of pose. I think that the placebo effect still needs to be researched a bit further. So there's a whole field that sort of kind of blossomed out of all this in the scientific community called psychoneuroimmunology, where they're actually looking at the mind to body relationship there. And that basically summarizes this video. So I hope you found it educational and valuable. If you did, please hit the like button, subscribe, and hit the notification bell so that you know when my other videos pop up. If you found this very helpful, you know, feel free to share it and spread the knowledge so that others can become more educated about everything that I'm trying to teach on this channel. If you have any questions or comments, please put them down below in the comment section. I'm very good about responding to those. And so until next time, take care, stay safe. Bye-bye. Pura Vida.